I think it's really important that we have the more information that we can try to incorporate into training our AI models, the better informed it's going to be, and hopefully, or at least our hope is that it's going to be able to have better predictions. It's going to be able to make it so that we're able to integrate that into the clinic a little bit better in our clinical decision making. It's still in its infancy. I think that's kind of one of the biggest cons, is that we don't really know exactly what's happening, under the hood, so to speak. But I think if we can take different types of imaging, different types of input that aren't normally put together, there's a wealth of data out there. I think we'll be able to better inform our clinicians and give them better tools to be able to make better diagnoses, better treatment predictions, and also predictions for systemic diseases too. But I think it's vitally important for us to be engaging on a broader scale with our patients and with the public, not just kind of one-on-one. Just because AI, it's so new and there's something scary about it. So I think that's something that's vitally important that we need to be doing, especially as researchers, is to say, this is what we're seeing with our research. This is how we think that it can help. And to be also very transparent about the pitfalls and where things can go wrong, just because we need to be giving people the right information and the whole truth about what we're seeing in our research, so that they're able to, when the time comes, better inform themselves on whether they want to incorporate AI into their care. Just because you can deny a treatment because you don't like its side effects. And I think it should be the same thing with incorporating AI into your care. And we need to be better, I think, as researchers and as our institution, at least, to engage with the public and engage with our patients that this is something we think can help, but people need to be able to make their own decisions. I just think, to your point, I'm a firm believer that science is for everyone, and it needs to be open, because knowledge is power. And we need to be able to, as researchers, I think we need to be able to communicate our science to people, to tell them what the implications are on their lives. Us specifically, we're kind of dealing in the medical arena, so we kind of talk about patients a little bit more, going to affect their lives, if it is going to affect their lives. So I think, public outreach is definitely something that is vitally important, and I think definitely maybe something that's a little bit more overlooked, but something that I think our kind of broader patient population would be very interested in, because I think, like you said, sometimes it's this expert knowledge person that they just tell you this is it, no questions, or maybe, if you have some questions, I can answer them, but this is the way that it is. And I think that's why people want to go to Google. That's why they want to go to some of these new tools like ChatGPT to ask questions, is because they want to be informed on their own health, on their own lives. And I think it's vitally important that we are able to take what we're doing research on and to be able to let the broader population know about how that's going to affect their lives and the people that they care about, their lives as well.